organization, health and health services that are accessible, acceptable, and quality. Um, we'll welcome Dr. James Fitzgerald, who's going to
Muchas gracias, Rodolfo.
opening
Buenos
words.
días a todos.
Thank you very much, Rodolfo. Good morning,
Representante de
everyone.
Salud,
Dear colleagues,
organizaciones de
representatives of
sociedad
ministries
civil,
of health, civil society
asociaciones
organizations,
profesionales, organismos
professional
internacionales y
associations,
participantes
international
de toda la
organizations,
región.
and participants
En
across the
nombre de
region.
la Organización
On behalf of
Panamericana
the
de la
PAHO
Salud,
Department
realmente
of
es un
Health
honor
Systems and Services,
darles
it
la
is an
bienvenida
honor
a este
to welcome
seminario
you to this
virtual
virtual
en el
seminar
marco
in the
del mes
framework of
del
Cell Care
Cuidado
Month 2025,
2025, donde nos
where
reunimos
we
para
gather to
reflexionar,
reflect, share
compartir
progress,
avances y
and
fortalecernos
strengthen our
en compromiso con
commitment
la
to
salud
sexual and
sexual
reproductive
y
health,
reproductiva, la atención primaria
primary care,
y el
and
acceso y
universal health coverage.
cobertura universal de salud. Vivimos tiempos
We are
complejos.
living in
Las
complex
crisis
times.
humanitarias, el cambio
Humanitarian
climático, las
crises, climate
desigualdades
change,
persistentes
persistent
y la
inequalities,
escasez de
and the
personal de salud
shortage of
calificado
qualified
nos
health
desafían a repensar
personnel
cómo
challenge us to
acercarnos
rethink
los
how
servicios
we
de salud
bring
a las
health
personas.
services to people.
En este contexto,
In
las
this
intervenciones en
context,
autocuidado
self-care
emergen como una
interventions
estrategia
emerge as
transformadora
a
para
transformative
fortalecer el sistema de
strategy
salud,
to strengthen health
empoderar a las
systems,
personas y avanzar
empower
hacia la
people,
salud
and
universal.
advance toward universal health
La atención
coverage.
primaria de salud, tal como
Primary health
lo
care,
establece la Declaración de
as
Astana,
established in the
debe ser
Astana
un eje
Declaration,
articulador de esta
must be
transformación.
the linchpin of
Las
this
intervenciones de
transformation.
autocuidado
Self-care
refuerzan tres
interventions
pilares:
reinforce its
servicios
three
integrados,
pillars:
acción
integrated
sectorial
services,
y
multisectoral
empoderamiento
action, and
comunitario.
community empowerment.
La OPS
The
reconoce que
Pan
las
American
intervenciones
Health
de autocuidado,
Organization
desde el autotest de embarazo, la
um,
autoadministración de
recognizes that
anticonceptivos
self-care
inyectables,
interventions from
hasta el
self-pregnancy
automuestro para
testing
VIH o
and
VPH,
self-administration of
permiten que las
injectable
personas
contraceptives to
participan
self-sampling for
activamente en el cuidado de su
HRV
salud
or
con apoyo
HPV allow
adecuado,
people to actively
información
participate
clara
in
y
their health
vínculos
care
efectivos
with
con los
appropriate support,
servicios.
clear
No
information,
son
and
solo
effective
innovaciones
links to
clínicas,
services. They are not
son
just clinical
expresiones concretas de
innovations, they are concrete
empoderamiento, equidad
expressions
y
of
acceso.
empowerment, equity, and
El
access.
autocuidado no reemplaza el sistema de
Self-care does
salud, lo
not
complementa,
replace the health
nos
system,
permite
it
ampliar el
complements it.
acceso,
It allows us to
reducir
expand access,
las barreras,
reduce barriers,
mejorar la
improve
eficiencia y
efficiency,
promover la equidad.
and promote equity.
Su implementación exige
Its
marcos
implementation
normativos
requires
habilitantes,
enabling
formación de
regulatory
personal de
framework,
salud,
health
financiamiento
personnel
sostenible y
training,
mecanismos de
sustainable
seguimiento y
financing,
evaluación.
and monitoring and evaluation
Estas
mechanisms.
intervenciones,
These
entonces, de
self-care interventions
autocuidado permiten, primero, ampliar la cobertura
allow for
efectiva en
expanding
contextos
effective
con escasez
coverage
de
in
personal o
context with staff of
infraestructura.
or infrastructures.
Segundo, optimizar recursos mediante modelos de prestación
Optimizing
más
resources through more
flexibles y
flexible and
costo eficaces.
cost-effective delivery
Tercero,
models.
fortalecer la APS
Strengthen
al integrar servicios de
PAC
promoción,
by
prevención,
integrating
diagnóstico y
promotion,
tratamiento
prevention,
desde una lógica
diagnosis, and treatment
comunitaria.
services
Y
from a
finalmente,
community
empoderar a las
perspective.
personas,
And finally,
reconociendo su
empower
capacidad para
people
tomar
by
decisiones
recognizing their
informadas sobre
capacity
la
to form
salud.
decisions about their
En
health.
América Latina y el Caribe
The
estamos
World Health
avanzando y
Organization
hoy compartiremos
has
experiencias,
developed a
analizaremos
robust
facilitadores y
conceptual
barreras
framework for this. In
y
Latin America and the
definiremos próximos
Caribbean,
pasos
we have
para
made
seguir
progress. At the
construyendo
regional
sistemas de
meeting in
salud
Bogota in
más
2024, we
inclusivos,
prioritized interventions
resilientes
to
y
accelerate the
centrados en
reduction
las
in maternal
personas.
mortality.
La
Today, we
salud
share
universal
experience,
no es solo un
analyze
objetivo técnico,
facilitators and
es una
barriers,
aspiración
and
ética.
define next
Es
steps to
garantizar
continue
que
building
todas
more inclusive,
personas,
resilient,
sin
and
importar su edad,
people-centered
género,
health system.
condición socioeconómica o lugar de
Universal
residencia,
health coverage is not
pueden
just
acceder
a
a
technical
servicios de
tool, it is
salud
an
de
ethical
calidad
aspiration. It means
y
ensuring that
sin
all people,
enfrentar
regardless of age,
dificultades
gender,
económicas.
socioeconomic
El
status, or
autocuidado entonces
residents
es
can
una
access
palanca
quality
poderosa
health
para
services
lograrlo.
without facing
Desde la
financial
OPS
hardship.
promovemos un
Self-care
enfoque
is a
integral
good
que
leverage to do
articula
so. At
el
PAHO,
autocuidado con las
we
seis
promote a
funciones del sistema
comprehensive
de salud:
approach that articulates
gobernanza,
self-care
financiamiento,
with six
prestación,
functional
servicios,
blocks of health
recursos humanos,
system:
tecnologías
governance,
sanitarias
finances,
y
service delivery,
información.
human resources,
Y lo
health
hacemos
technology,
desde
health
los principios y
information.
valores de
And
la
we do so
organización:
based on
el
the
derecho a la
principles
salud,
of human
la
rights,
equidad y la
gender
solidaridad.
equality, ethics, and community
Bienvenidos
participation.
entonces a este
I
webinar
invite
y
you
esperamos que
to
sea
approach
productivo
this
para todos.
meeting with
Muchas
a
gracias, Rodolfo.
strategic, evidence-based, right-centered
Muchas gracias,
approach.
doctor.
Welcome and thank you for your
Sharon. Y
commitment to
ahora
more
los
human
invito
care and more
a
accessible
mirar
health.
un
Thanks,
video muy corto
James.
que nos va a poder
Now let's take a
mostrar
look at a very
los,
short video that
algunas de
will
las
show
personas que
us
son
the voice
los
of some
actores
people
y las
who
actrices
are
de este sistema de salud que nos
players
propone
in
una
this health
innovación como el
system
autocuidado.
that
Por
proposes
favor,
such an
Tatiana,
innovation
el
as
video.
this self-care.
Adelante.
Tatiana, please, the video. Go ahead. The objective in this workshop is to define, regional self-care workshop. The objective of this workshop is to define priority lines for action from our agency for self-care of women and their families to reduce maternal mortality. It's the foundation for change health results, particularly in more vulnerable people. In this way, we can empower a person and we empower communities. Care for people who live with HIV is extremely important. I'd say it's a matter of life or death. I have lived with HIV for 24 years, and I can tell you that everything is self-care. Do not understand as something that's substituting healthcare services. Self-care improves access to healthcare services for people who are in rural areas or who do not have much schooling. This is very important. Thanks to technology, which is in our hands, communities can really empower their health because, and that's why this is extremely important. For us as young people, it's fundamental to use community networks and youth networks, and this is not built in a clinical space only. It's built in the quarter, in the market, on the street, and these are spaces where healthcare services have to go and vice versa.
Challenge, being very close to 2030 is a deadline for SDG. This challenge is structural. We do not have enough healthcare workers. We have increasing out-of-pocket expenditure, partly due to reduced financial spending in health. We also have increasingly contractual challenges that include crisis linked to climate change, linked to geopolitical challenges, and we very close to the 2030 deadline of realizing SDGs, and therefore we really need to think of new and different strategies to reach the goals we set for ourselves, and self-care is part of those strategies.
Promover la salud, proteger la salud y promover el acceso a los
Promoting health, protecting it, and promoting access to healthcare services is one of the tools to reduce maternal mortality, particularly accelerating reduction, accessing self-care practices, family planning that do not necessarily require always the intervention of a healthcare professional. These are interventions that exponentially increase access to health system. Self-care.
Muchas gracias.
Thank you very much. Now, let's continue with our webinar. We'll start with the first presentation. I'd like to introduce Manjula Narisman, who is our colleague, who will participate from the WHO. She will talk about some critical concepts in self-care for sexual and reproductive health. Our colleague will talk from Geneva. She's had some inconveniences to connect, but please, there is interpretation service in Spanish, Portuguese, and English. So please select at the bottom of your screen the language you would like to listen to presentation in. Majula will speak in English. So those who need translation, please select the language,
We will have
the
translation
Spanish
in
language.
webinar in 3 languages, Portuguese, English, and Spanish. Please select your language. The following presentation will be in English, and our colleague Manjula Narisman from the Department of Sexual and Reproductive Maternal Newborn Child Adolescent Aging Health and Research in the WHO, the World Health Organization from Geneva, will be presenting the next presentation. Please, Manjula, the floor is yours. Go ahead.
Can you hear me?
Yes, clear.
Oh, wonderful, wonderful. And I'm so sorry for all these technical issues. So thank you for that invitation, and thank you, Rodolfo and colleagues, for organizing this webinar. It's really, really exciting to be here. So we, as Rodolfo said, our new department's name is quite long, as you can tell, but it covers this life course approach from newborn to aging. And it's actually really important that we're seeing the self-care in the context of this life course approach, because it is something important across every stage of life, but also important to every person across their life stages, from the newborn phase, the adolescence, during maternity, during reproductive, during sexual health, during aging processes, not just for SRHR, but also NCDs and other areas. And on this slide, we can see that, I think we're on the second slide. Yes. So we can see that self-care is actually the first line of action for all of healthcare. It's the first step we probably take in the morning, whether we're brushing our teeth, whether, and maybe the last thing we do in the day. And often when people think of self-care, we're thinking about, is it health promotion? Is it about eating better? Is it about what decisions one makes about their health? Yes, that's also true. But what we are saying from a health system perspective, and this is an increasingly important area in the health systems, is that self-care has now a whole range of interventions, of products, of services that can support individuals and communities and families to improve their health, to maintain their health. Next slide, please. And while self-care is the basis of all of healthcare, it is also an essential component of healthcare delivery. So it is not meant to replace health delivery entirely, but it is something that complements many of the aspects of healthcare and health delivery as we know it, whether it's through pharmacy access, whether it's through clinical facilities, whether it's specialized care. All of these will continue to exist and must exist, because self-care can't replace everything. But it is a starting point, and it is something that can ensure people having better autonomy, better agency. It can be cost effective. It can be increase efficiencies in the health systems. And it has been shown repeatedly, and COVID-19 is one example of this. It's been shown that engaging people to better manage their health is possible. It can be done in virtually every setting, and it can lead to better health outcomes, both by reducing mortality, by reducing morbidities. And for that reason, WHO, next slide, please. WHO has recommended self-care for every country, every economic setting, and as a critical pathway to universal health coverage, to keeping the world safe and serving the vulnerable. And this is particularly important because self-care is important on the everyday life, but it's also important in humanitarian settings, at times when people are, if there's conflict, whether there is a climate change related event. And so self-care becomes important in those aspects as well. It's also important for people who are vulnerable, who may not be accessing health systems, who may not be accessing the quality of care that is needed. And self-care provides options in those spaces as well. I can no longer see the slides, so I don't know whether you can, but Rodolfo?
Yes. I'm
Yes.
sharing again, please.
Okay. So I think so the next slide. Yes, there we go. And so so just the previous slide, very quickly, is we talk about self-care as this umbrella term about the ability of individuals and families and communities to promote health, to prevent disease, to maintain health, and to cope with illness that can be with or without the support of a health or a care worker. And these interventions and actions are actually tools that support self-care. And they could include medical devices to measure blood pressure. It could mean diagnostics, such as an HIV self-test. It could be drugs that can be used to self-manage certain conditions. And all of these can also be provided through digital health and other means. So self-care, as we call it, is a very much an umbrella term, but it encompasses biomedical interventions, but also actions, both by the health systems and by individuals. Next slide, please. So just while we're waiting for the slide, I don't know whether it's moved, but there's certain examples of self-care that many of you know. I just wanted to reflect on these because, for instance, if we go back there we go. Self-care, if we take the example of women's health, self-care has been shown, and there's plenty of evidence that it's improving the autonomy and agency. So, for instance, with the use of an HIV self-test kit, women can test themselves without having to visit a clinic. It can increase their access to not just the testing, but early diagnosis and decision-making. It supports their autonomy. It is also shown to reduce stigma. Next slide, please. But other areas of women's sexual and reproductive health, for instance, the access to self-injectable contraception or HPV self-sampling are two other examples that are now widely prevalent and need to be increased in terms of access and coverage for many women who may need it. And if we take the example of the HPV self-sampling, for instance, this is when women can collect their own cervical samples. They can send it to a clinic or some laboratory facility, get the test results either through their phone or through a meeting with a health worker. And if it's negative, they can go back to business as usual, or they get a retest. This self-care intervention may be the only way to reach the screening targets that countries have set. And so to reduce cervical cancer, including this self-care intervention, will be an essential way to reach that coverage and those national goals and targets. Next slide, please. And the guideline from WHO actually covers a whole range of recommended actions and interventions for self-care. It covers recommendations for antenatal care, delivery, and postpartum care, contraception, including infertility, safe abortion, STIs, HIV, and promoting sexual health as well. In addition to this, there are recommendations around NCDs, such as monitoring blood pressure, blood glucose. It has recommendations around certain settings, such as humanitarian settings, around certain underserved communities, such as transgender individuals or people living in refugee camps and others. So it covers a range of issues that are important to facilitate introduction and uptake of these options. Next slide, please. And it's grounded in a conceptual framework where, I won't read all of this, but it's basically about putting people at the center of the process. And when we do that and we place the individuals at the center of action, we are able to provide a holistic approach to their health. So, for instance, if somebody goes to a pharmacy to pick up a self-care option, let's say a pregnancy self-test. The pharmacist could provide them possibly with a syphilis self-test or another diagnostic for another STI. They could ask them, do you need a contraception? Would you need something to monitor your blood pressure? So there is a range of options that can be provided at different points of access that cover a more holistic approach to what their health needs may be. And the conceptual framework from WHO places the individual at the center and their health needs in a human rights, gender equality, holistic, ethical approach to this, and acknowledges that people access information and counseling and services and products beyond the traditional health facility. And this is not going to change. This is only going to increase in the future. We have seen that people are using their phones, they're using telemedicine, they're using the pharmacies, for instance, and other ways of getting the information, the counseling, and the services that they need. But they need to do this within the constructs of a safe and supportive, enabling environment. And some of the aspects of this enabling environment are written on the slide. And it's really important that for those, for instance, who are underserved, who may be subject to violence or coercion, discrimination, stigma, self-care is not, it should not be the only option they have. They need to be able to have a supportive, enabling environment in order for themselves to have better agency regarding their own health. So it's not an either-or scenario, it's a complementary scenario. And only then can we have that accountability. So the responsibility of individuals to act on their health, but also the accountability of governments, of the private sector, of the health systems, to be able to provide better care that also includes self-care. And this means making sure that the quality and the safety of products are there, but we need to address issues such as some of these gaps in the enabling environment, so that we can integrate self-care into national health policies and programs and systems in a meaningful way. Next slide, please. And so in this slide, so we see that there's an implementation guidance that has been developed. And the implementation guidance is very much focused on the health system building blocks, which I know many of you are very familiar with. So we have these 6 health system building blocks, and we have attempted to provide examples of key elements of how to introduce self-care within these building blocks, and how this can help advance primary health care by improving the agency and the autonomy of individuals and communities. But it's also about addressing social determinants of health, ensuring that we can improve coverage, advance UHC through self-care options as well. Next slide, please. And I'm just going to go very quickly through this. The self-care competency framework is mainly designed for health and care workers. It comes in 3 components. One is about supporting the standards of care that health and care workers may need. The second one is about the knowledge guide that, should they be lacking in some of these competency standards, how can that be strengthened? And then the third one is a curriculum guide in terms of improving training, whether it's pre-training or in-service training for health and care workers. I'll just go through these very quickly because the slides are quite dense. The next slide, please. So these are some of the standards. So we have looked at self-care through 10 key competency standards for health workers, and some of these are listed here. I'm not going to read them all, but just wanted to point out that self-care is for health workers to promote that as an option. So if somebody is coming to a clinic that, for contraception, for instance, that the health and care workers can trust the individual to provide them with the information that they need of the various options that exist, including perhaps an option that is a self-care option. So there is that element, but there's also the element of managing one's own health. So we've seen that in many instances, health and care workers can face burnout, can face overexertion, and self-care for themselves is also important in this instance. Next slide, please. And the knowledge guide is, as we said, about the methods of strengthening that some of these standards. And so, for instance, in the people, how do we better center the people-centered care for individuals? And so, again, I won't read this out, but it is structured around those key competencies and how to best support health and care workers. Next slide, please. And the curriculum guide is similar, again, going back to the 10 standards of care. It's designed in five aspects, and it is about, again, the kind of training that may be needed. And this could be, a once training or a continuous training, and at various levels, depending on the cadre and the needs of the health and care workers. Next slide, please. And a lot of the resources and tools from WHO are included in this toolkit. We update this every year. We launched this for the Self-Care Month and the Self-Care Day, which happened on the 24th of July. And many of these tools are resources for all our regional offices, our country offices, but also for our partners working in self-care. So you're very welcome to use it, to adapt it. If you have any questions, please feel free to reach out to us. I just want to end by saying that, we live in a time where, particularly for sexual and reproductive health and rights, and maternal health and other aspects of newborn and child and adolescent health, we are really affected increasingly by politics, by religion, by bigotry, and many aspects that curtail people's ability to live their life to their fullest. And if we are able to provide self-care options to those around us and for ourselves, we could have much healthier societies and much healthier individuals. And at the end of the day, the richest wealth for anyone is their own health, and for societies and for countries to have people in good health. So thank you all very much, and I'm really delighted to hear that there's so much interest in self-care, and I look forward to hearing the rest of the presentations. Thank you.
Thank you so much, Manjula. As usual, we enjoyed a lot your presentation. Muchas gracias, estimada Manjula. Muchas gracias de verdad. Si hay alguna pregunta en el transcurso, hemos visto.
Thank you so much, Manjula. If there are any questions, because we saw some questions in the Q&A, if you have any doubts or some comments, this is the moment to do it. We do have a few minutes, just one or two questions for Manjula, and we would thank you to ask these questions. We were asked if the materials have been translated into Spanish, and yes, the answer is yes. The majority, almost all of them, have been translated into Spanish. And to have access to them, you just have to go into the webpage of the Pan American Health Association or the World Health Organization, and there are these three that Manjula presented. So if there are any other questions, please write them down on the chat or the Q&A.
hay saludos desde
There are
México.
greetings from Mexico.
Que por favor compartan los enlaces para el repositorio.
And the petition to share the links on the screen. Well, the whole repository of all these tools, and especially communication tools, are available.
Manjula, we have a question maybe for you directly. I will read it for you. Said that would not be positive to incorporate the HIV and STIs to the routine medical exams for every client, every patient. I think that would be very good to reduce the stigma and for persons that are, using some protection. And in 21st century, sounds ridiculous that people from 40 to 50 years old never had an analysis of the STIs because of afraid or stigma or not recommendation. That is a question from Javier that is for you, Manjula. Will not be better to open in every single consultation the test option than the self-care option? Open to you. Manjula, can you hear us? Mientras Manjula logra conectarse, voy a intentar responder a tu pregunta, que es muy clara, y vamos a tratar de
Can
ser...
you hear me?
Yes, we can hear you.
Oh, I'm so sorry. I'm just, yeah, it's just one of those things. If I heard the question correctly, it's about, should we not make self-tests more widely available during, all the consultations? Was that the question?
Closely, but the question is why not including in every consultation a test made by the health system rather than to use the self-testing?
Oh, I see. Well, I think, yes, so it's not a question of, as I said, either or. I think if, we know that when we increase options, when we have more than one option, it's always better for the individual. So there are people who may prefer to do the test at the clinic. There are others who may prefer to do it at home. And, if we take the example again of COVID, we needed to have those self-tests available in many locations, not just at the clinic. We needed to have it available at the pharmacy, at home, before the travel, after the travel, and the same way for for HIV or for pregnancy. Having self-tests available at home doesn't mean that they don't need to be done at the clinic. And certainly for like HPV self-sampling, many women prefer to come to the clinic, but they can take their own test at the clinic and drop off the test at the clinic. So it's not an either or scenario, but certainly something that when we increase the option, we can see that we're also increasing coverage. Does that,
Sounds very good. Thank you so much, Manjula, for the answer. It was, as always, very clear. And if you have more questions, please do share it into the Q&A mode, and we will be able to submit the presentation and the questions for you later. Ahora, avanzando en el programa que tenemos pensado para ustedes hoy, vamos a comenzar una
Now,
mesa
making
panel
progress in our
con
program,
una pequeña
we will start a panel
reseña de hasta
with
dónde
a
caminamos juntos
short,
hasta ahora, con un grupo
short comment
que comenzamos esta caminata en 12 países
of
priorizados,
where we are going and when we
realizados
started and
por
where we started.
número
And
o
we will
la tasa
start with the number of maternal deaths in the countries, and we will tell you about some successful experiences. We know clearly that in our region there are huge disparities, differences, especially in what is the access to Planned Parenthood. For example, the percentage of fertile women that do not want any more children or want to postpone the next child and are not using methods to prevent pregnancy has been analyzed, and the Executive Council was at the 60th meeting of the Pan American Health Organization, and it was this access to sexual and reproductive health methods and services was assessed for this meeting. We prepared this at the Secretariat, and here we see one of the huge problems of these disparities that comes up, especially with regard to access. There are populations in the same country that have huge differences in services for sexual and reproductive health. So this is one of the great differences and great gaps between population groups. And we have listened to Manjula how self-care can become a bridge between health services and the population. And the access to self-care is very important in that. And there are 38 directives. Some of them are recommendations. Some of them are, for example, very simple for injectable prevention methods or anticonceptives, pregnancy protection. And there is also the recommendation that pregnancy prevention methods, oral ones, could be acquired without a medical recipe prescription and freely at pharmacies. And the WHO has put together successful practices around the world. Here and on the left side, it has been documented how there is now a better access to care in the world. And after the publication of these guidelines of the WHO, we did a review in 2022, and we assessed the feasibility of this practice and how countries made progress. And so we had the first methodological meeting, and then we published this document. Here we see the first page where the CIPS team received, where there is a thank you to the team and to the countries that put forward the information. And here we can see on the horizontal lines the practices for self-care, and in vertical lines if this has been implemented or not according to the country. And this is the information provided by the countries involved. In Uruguay, for example, and we have with us the Vice Minister. We are honored by the presence of the Vice Minister of Uruguay. The role of self-care was taken into account for a safe abortion, and there were some very important changes and changes also in the law centered on women and self-care as a strategy. And so in the video, when these self-care practices were launched, Uruguay has implemented these practices quite early, even before the guidelines of WHO were published. Uruguay had already analyzed all these practices and implemented them. And so the number of maternal deaths was reduced very fast. We will hear about their achievements and hear recommendations also about hormonal conception preventive methods after an abortion, or for example, these are methods of long duration methods, and we have to involve also the self-care practices and the user and examine the degree up to which these persons can provide self-care. And as Manjula showed us in these three theoretical frameworks that she explained very well, and here are the first pages of the publications in Spanish. And I also want to show you very proudly the development of this sort of tool, wheel tool that shows you the possibilities of self-care, and it was received very positively by the countries. And these are the countries that shared their information with us in October in Bogota last year. And here, well, we invited them to share with us their figures and their achievements. And here we see some indicators that allowed us to see how self-care was being implemented. And this is the final paper from the Bogota meeting last year, where we asked the representatives of these 12 countries of the region if this issue was new for them or if they had learned something. And they all said that it was very useful and quite a novelty. And we also asked them, when we're speaking of self-care, what word comes into your mind? And so it's also self-respect, responsibility, health, and well-being. And so all of them could share these comments with us. And they proposed 5 actions that have been prioritized here. Education in first place, financing, second place, training healthcare workers, third place, priority communities and populations, and fourth place, and general access. One of the recommendations of this technical group was to organize regional webinars, which was what we are doing today. And they also asked us to create work teams with the support in the countries with the support of PAHO and UNFPA, and we need to work on the inclusion of on the inclusion of subcutaneous methods in the basket of different methods offered. And in October, November of this year, we will have a new meeting to evaluate the progress made. And we also want a South-South cooperation of good practices among the countries. We want to create a repository of good practices and the sharing of experiences. And PAHO will do it in all of its regions. And the other areas of the organization will be linked to this. And it was also proposed to reduce, with regard to reducing maternal deaths, and with regard to some of the commitments of the 12 countries that participated in this meeting, what could be done to improve access? First of all, to promote self-care practices, especially pregnancy tests in HIV and anti-conception methods, pregnancy prevention methods, and also to develop educational material sensitive to the culture of these communities, to make use of digital tools, as one of our colleagues was saying, that is because to work on HIV and to promote or to involve health promoters, local health promoters and community leaders in these self-care practices, to develop support networks centered on the community, and to promote policies that integrate self-care and also promote sustainable financing, and to face economic, geographic, and cultural barriers by involving remote and marginalized communities, and also policies sensitive to gender to help with self-care, and to respect the principles of confidentiality and non-discrimination and informed decisions in the initiatives of self-care, to establish monitoring systems to assess the effectiveness of these methods. And once we have been able to monitor and to monitor the findings, to share them, and to develop joint measures. Thank you very much for being with us today. Here we leave some links with you and some videos on the practices of self-care. Now, I want to present the panelists of our panel. First of all, the coordinator of the panel, Tatiana. Could you please show the slides? I want to introduce Dr. Gabriela Perrota, who has a PhD in psychology and is an independent consultant for PAHO. She is the ex-technical coordinator, the former technical coordinator of sexual and reproductive health at the Ministry of Health in Argentina. She teaches at bachelor and postgraduate studies in Argentina, Argentina universities. Good morning or good afternoon, depending on where you are. If Tatiana could share my slides, I invite Lionel, Camila, and Monica to share their screens so that I can introduce them. Welcome all. I will introduce first of all Camila Gasparo of Brazil, who works in prevention of maternal deaths at the Ministry of Health in Brazil. I also want to introduce from Colombia Monica Castro, who is the coordinator of the Life Course group, and she also works at the Ministry of Health and Social Protection in Colombia. And from Uruguay, Dr. Lionel Brioso, who works at the Ministry of Public Health and also is also a teacher at the gynecological clinic and faculty of medicine, is part of the faculty of medicine at the República University. We'll start the panel. I will ask you three questions. One first question is, that I ask you three, and I would like to ask you to share your answers with this webinar. The first question is, how has your country integrated the self-care initiatives in the policies or national strategies of health in order to achieve better universal health care? Camila, would you like to share some ideas with us? We know we have little time, but we hope that this is enough to share.
Bueno, muchas gracias.
Well,
Buenas
thank you very
tardes o
much. Good
buenos días.
afternoon or good morning.
Gracias, Gabriela, por
And
la
thank you, Gabriela,
presentación.
for
Gracias
the
por la invitación
presentation
para
and for the
podermos
invitation.
hablar hoy y este tema tan
And this
importante para todas las
to
mujeres
speak on
para
this
Brasil
important issue for women, and in Brazil especially, when we talk about facing maternal health or maternal deaths. In Brazil,
voy a intentar hacer un resumen.
I will try to summarize what happened, I'd say, in Brazil. We have a law now that dates from 2024 that instituted the national care policy. And one of the guidelines of this policy is self-care. And it also states which are the target groups for this policy. So there is a discussion on women and everything that is included in self-care for women, and the care that women provide for themselves and others, and for vulnerable populations. So there is a discussion for the Black population, for indigenous women. This policy is quite new. It dates from last year, and we now have another law initiative that goes in the same direction. But it also wants to institute as a national day for self-care on June 24th, and a deeper discussion on self-care policies at national level. In order to add this to the discussion. And the Ministry of Health, at the Ministry of Health, we have guidelines. We have a guideline for primary healthcare workers, especially centered on chronic diseases, that tries to support the professionals of primary healthcare for self-care more related to chronic diseases. But it's an interesting vision. It provides an interesting vision of the professionals that are involved in these care methods. And especially for sexual and reproductive health, nowadays we have an incentive from the Ministry of Health for the local government so that they can acquire the quick pregnancy tests, the self-tests for pregnancies. And because now the women have to go to the health service, but there they are provided with this test, and it's free of charge. So they just have to go to the medical center and ask for it. And it's also distributed at these primary health care services. We also distribute condoms and oral anti-pregnancy means tablets. The prevention is free of charge, and neither women nor men have to pay for condoms. And all of this has to do with sexual and reproductive health. Monica, what are your
Bueno, muchas gracias.
ideas
Creo
about
que solo
this?
partiría de comentar que comprendemos el cuidado
Well,
en
thank you very
esa
much. I would just
esfera
say that
tan
we
amplia como el
understand
cuidado de sí
care
y el cuidado del
in
otro, el
this
cuidado del
very
otro. Entendemos
broad
el cuidado como
sphere
una
of
competencia
everybody's
no
care. We
solamente de los
understand
sujetos, sino del
care
Estado
is
mismo
a
y de todos.
competency
Y
of
entendemos el cuidado
individuals,
muy
government, and
unido a una
everybody.
capacidad
We
para el
understand
cuidado que todos
care
tenemos
as
y una capacidad de
our
agencia.
capacity
Entonces,
for care and
parte de
our
lo que voy a
capacity for
comentar no es esta
agency. And
fuera o
part
allá,
of what I'll commend
desde esa referencia. Uno dio
has
esa
that
apuesta, digamos,
approach.
en el marco
And
normativo en
we
torno a la ley
bet on
estatutaria en
the
salud,
regulatory
lo
framework,
que hoy se define como el modelo
the
preventivo,
law,
predictivo,
and
resolutivo, con una fuerza muy
preventive,
especial a la
predictive, and
APS y a una
resolution
fuerza también
approach
a ese vínculo entre las
that
comunidades y los
makes
sistemas de salud,
primary health
y un poco
care
en ese
strong,
empoderamiento
as well as
que se
health
señala
systems.
en todo el marco del
And all
autocuidado.
this
Lo otro
empowerment
es
is
un
marked
elemento clave para
in the
nosotros,
self-care
es la
framework.
resolución de 3280 de
Also, the
2018 que incorpora
3282
la ruta de promoción y
2018
mantenimiento de la salud y la ruta
resolution that
materno-fetal, y
has
ese
to do
orienta
with
tanto definir los límites educados
mother-child
en salud y
care
están puestos a
and
la
health
capacidad
care
de los sujetos en
that is
reconocer si es que
connected
podemos
to the
avanzar
capacity of individuals
en esa
and
consolidación de
acknowledge if
capacidad,
we
y
can
define las
progress in building
intervenciones
that
que están
capacity. It
destinadas
also
para ello.
defines
Entre
interventions that
ellas,
are
pues
aimed at
lograr
that,
unos
among
procesos de
which
educación para la salud,
achieving
estabilizar la
education for
única
health,
capacidad de
uh,
agencia y de capacidad de
because that
cuidado,
has to do
unas
with
estrategias de
agency and
información y
care
comunicación y
capacities,
un proceso de redes,
information and
llamado los
communication
plus, más
strategies,
amplios de esto,
networking,
y luego unos procesos de
and
adaptabilidad en todos los
also
servicios de salud que
adaptability in all
implican hacer
healthcare
un ejercicio
services
con el talento
that
humano y
imply
las
an
instituciones.
exercise with human
Luego,
talent and
en el marco de la
institutions.
resolución, en el
Also, within
marco de
the
la
framework
ruta
of our
materno-perinatal y la
resolution
ruta de promoción
and
y
mother
mantenimiento,
care and
queda
mother-child
establecido
care,
desde 2018
as
los
established in
procedimientos de
2018,
interrupción voluntaria del
there
embarazo, y
is
eso tiene un siguiente
voluntary
momento
interruption
en
of
el 2023, donde se
pregnancy.
incorpora,
There's
según la
follow-up of
sentencia
that
de
in
la Corte, la
2023
IVE
when
antes de la
um,
semana 24
that is
sin necesidad
incorporated
ninguna
for
causal, y
court
luego de ello, pues con las
before
causales que se
week
definieron
24 with no cause, and then
específicamente,
after
pero esto da un margen,
wards
digamos, un poco más amplio
only
y
in
unas
three
definiciones a
cases
propósito
that provides the
de las
framework and
adecuaciones de la
definitions
atención. Luego hay
concerning
una ley del parto digno que
care,
también nos hace unos llamados
concerning
importantes
care. Also,
a
dignified
consolidar unas
or
condiciones
decent
adecuadas
delivery
para
with
ese proceso
adequate
de atención del
conditions
parto,
for
con todo el
um,
respeto, digamos, a la
delivery
autonomía
care with
de la
all
mujer.
respect
Una
for
resolución que
women's
emitimos este
autonomy.
año
A
para dar luces
resolution
a
we
propósito
issued
de la
this
autonomía
year to
progresiva de niños, niñas y
um,
adolescentes
shed
en el
light on
marco de
the
la salud y
autonomy
de
of
la
both
atención en
girls
salud,
and
que creemos que es
adolescents in
muy, muy importante.
health
Y
care, which
finalmente,
we
un
think is very
ejercicio que ha
important, and
liderado en
finally, an
igualdad para
exercise
establecer
that
este año la política de
provides
cuidado, que
equality
seguramente
for
unido al modelo
our
preventivo
care
predictivo nos va a
policies
ayudar a darle
together
fuerza a
with
la APS y darle fuerza a
our
la voz
rules
de los actores
resolution.
en el
It will
territorio.
strengthen primary health care
Gracias.
and the voice of
Muchas gracias,
players in the
Mónica.
territory. Thank you very
Leonel.
much, Monica.
Un
Leonel,
gusto estar con todos ustedes.
it's a pleasure to be with
Nuestra
all of you.
concepción del
Our
Sistema Nacional Integrado de
conception
Salud que
in the
tiene
national
el país
integrated
es
healthcare system in
estas
my
intervenciones
country
de autocuidado
is these
que sean
self-care
siempre
interventions should
efectivas
always
y
be
basadas
effective
en
and
evidencias,
based on
que
evidence,
sean una
evidence-based.
seguridad y calidad
They should
asistencial,
be safe
que promuevan la
and they should
continuidad de
have
los
quality,
cuidados y que
promoting
fortalezcan el sistema.
continuity of
Y
care,
creemos que
strengthening
estas
the
cuatro
system. And
características,
we think that
el
these four
contexto de lo
characters,
que es el
these four
autocuidado lo reúne,
characteristics
en
um,
particular con respecto
uh,
a las
are
intervenciones
related to self-care,
efectivas basadas en
particularly with
evidencias.
effective
Esto es
interventions that are
fundamental para
evidence-based.
la labor que
This is
tenemos como
fundamental
autoridad
for the
sanitaria
work we
de
have as
empoderar a
health
la población, en
authority
particular a
of
las mujeres, en sus
empowering
derechos y
people,
para mejorar la
particularly women,
capacidad de toma de decisiones conscientes,
in
es
their
decir,
rights and
libres, informadas y responsables.
conscious
Con
decision
respecto a la
making, that
seguridad y
it's
la
free,
calidad,
informed, and
nosotros tenemos una
responsible.
visión de integrar
Concerning
la estrategia de
quality and
autocuidado con la
safety, there
estrategia
we
de
integrate
seguridad de los
self-care
pacientes, que es
and
una estrategia dentro del
safety of
sistema
patients, the
asistencial
strategy
que
in
busca
the health
mejorar
system
los procesos
seeking
asistenciales
to
y cuando hay
improve
eventos
health
adversos poder
processes and
analizarlos
when there
adecuadamente.
are
Creemos
adverse
que
events
perfectamente se
to
complementan
be
los
able to
autocuidados con
adequately
la
analyze
estrategia de
them.
seguridad de los
Self-care
pacientes
is perfectly complemented with a safety strategy for patients, also promoting healthcare continuity. There's a fundamental role here that has to do with not separating self-care from traditional care, to call them in some way, that is provided by health teams in the health system. So we have to consider self-care as an integral part of the health system. Also, to strengthen the system, our government is strongly working on having patients who have diseases, system users, and their families involved in social participation to strengthen the system. And we think that this self-care line is very important because it'll generate the need for users to get to know their rights, their possibilities, and become involved in the activity and governance of the system that is foreseen in our law. This is our general framework, and we have this specific experience, as Dr. Gomez said, which is reducing risk for abortion. We developed that in 20 years ago when abortion was
Gracias,
illegal
Leonel. Sí,
in
ahora con
Uruguay.
alguna de las
And
otras
we can
preguntas
give you
seguramente
details on this.
te
Yes,
voy a dar
thank you.
pie para que cuentes un
So
poquito sobre esa
thank you,
estrategia. La
Lionel.
siguiente pregunta es
Yes, you'll
entonces
have some
justamente qué estrategias
room for
o
telling us
iniciativas se han
yeah.
implementado
What are the
para generar
strategies
demanda
or
de
initiatives that
autocuidado
have
y
been
empoderar a las
implemented to
personas y
generate
comunidades
self-care
para que se
demand
hagan
and
cargo de su
empower
salud
people and
utilizando
communities to
intervenciones
become in charge
basadas
with
en
their health
evidencia?
using
Camila, nuevamente te doy la palabra.
that are evidence-based?
Bueno, en continuación,
Camila.
gracias,
Okay, to
Gabriela.
continue. Thank you, Gabriela.
Bueno, en Brasil, o sea, tenemos
In
una
Brazil,
gran discusión
we have a great
que se
debate
está poniendo ahora para nosotros sobre el autocuidado
on
en
self-care
relación a las
in
mujeres que están
connection
embarazadas, ¿no?
to
Tenemos
women
ahora una
who are
estrategia
pregnant.
que estamos
We
haciendo
have
y que fue
a
con el
strategy
doctor Rodolfo vino acá ahora en
that
mayo
we
y
started
estuvimos
when
con un
Rodolfo was
equipo
here in May.
de la OPS
There was a PAHO
y
team working with
con el
us,
apoyo también
and
de
we
la
were also
OPS de
supported
Brasilia, de aquí
by
de Brasil, y
Brazil's
tuvimos una gran
PAHO.
discusión sobre empoderar a las
We have
lideranzas
a great
comunitarias, a
debate
los
to
profesionales de la atención
empower
primaria
community leaders
para las
and primary
emergencias
health care
obstétricas.
professionals
Uno
for
de
obstetric
los videos
emergencies.
que el doctor Rodolfo pasó
One of
antes,
the
que él
videos
tiene
that
el disco
Rodolfo
azul,
showed,
¿no? El disco
he showed
con
the
los colores,
blue
todo
disc,
eso.
right,
Y
with
estamos
all those
ahora
colors there. And
desarrollando cómo
we're
llevar
developing
esto para
uh,
todas las provincias de
how
Brasil
to take this
y
for all the
entrenar los
Brazilian
profesionales, ¿no?
provinces to
Para que
train
puedan
professionals
llevar también a las
so
liderazas
that they
comunitarias, a
can
las parteras
um,
tradicionales y
be
las
taken
liderazas
to
en general,
community
¿no? Para toda la
leaders,
población de indígenas, de
uh,
la población de
traditional housewives,
Quilombolas.
and all the
O
indigenous
sea,
peoples,
estamos en este
Quilombolas,
momento
and
tentando hacer un
uh,
plan de
all
desarrollo
the other
de
ones.
esta
We're
discusión
trying to
para todo
um,
Brasil,
prepare
relacionado
a development
a
plan
la
for all of Brazil in
prevención
connection
de las
to
emergencias
preventing
obstétricas especialmente.
obstetric
Y
emergencies, particularly.
creo que esto va a tener espacio ahí
And
este
I
año
think
y el
we'll
año
have
que
some
viene
room
de una
this
manera
year
importante.
and
O sea,
next
estamos
year
ajustando, haciendo
to
adaptaciones para
adjust
nuestra
and
realidad. Debemos
adapt
empezar en
to
octubre
our reality. This work should start in
los
October.
entrenamientos para todo el país
Training to the entire
de estas
country
discusiones, de estas cuestiones
concerning
relacionadas
these
a la embarazo
debates related to
que es esto.
pregnancy.
Gracias,
Gracias.
Camila.
That's
Muchas
it.
gracias.
Thank you. Thank you,
Mónica.
Camila. Monica.
Bueno, yo creo que aquí ha habido pues un despliegue que
I
para
think
nosotros ha sido
there has
importante.
been
Uno, pues
an
todo el
important
marco de la
improvement for us
información en
here.
salud.
All the
El año
information and
pasado se
health
desplegó
framework.
una
we had a self-care campaign last year. It was conducted by the Ministry of Health and the Self-Care Association. I think it was uh, strong and made all our strategies visible at MinSalud and in the territories, not only strengthening, detecting alarm signs, but also taking into account all the care defined in um, prevention and model child care, which is something we must guarantee to all the population. There is a word line about that in Colombia. We have adapted information and communication pieces there. There's a project that tackle or that addresses migrant people and refugees with European Union resources. We are strategizing on that. We must understand that information and communication needs to connect with people. If not, we won't be able to make them autonomous in what has to do with healthcare. Also, there's a bet on basic themes to define and build consensus of care plans with families and people, identifying the objectives in doing so, not only through actions that others decide for families and people, but to take into account other ideas that families and individuals decide to incorporate in their lives. There can be significant changes. They can be self-care practices, classical ones like physical activity, but also changes in terms of their relationships as families and also their relationships with support networks. That's very important. There we have primary health care initiatives with modules for people who want to consult. There is a big bet for boys and girls care, and this is recognized in the plan to accelerate maternal death and uh, um, infancy death. And these networks bet on their agency and self-care. We acknowledge networks in the territory, but also work on education for health. We have also deployments through the first or early childhood clinic. We do that with PAHO, and this is care in early childhood. That's for mothers and personnel. And IEPI, which was the central care for diseases that are prevalent in early childhood. And we want to have tools for those health community actors. We also have an exercise in stop maternal mortality. The idea is to do follow up to post-obstetric contraception and also do follow up to sexual violence. And we also do follow up to pregnant women, developing a module so that they can directly access and check what's happened with them, what's the care that is pending, and that helps favor autonomy and capacity for self-care. Some health care providers have safety work with sign monitoring and a permanent relationship with healthcare providers, and also telemedicine for some abortion cases. There we send the kit to the person and we monitor. And finally, in terms of intersectoral coordination, we have the bet on rural and and
Gracias,
healthy
Mónica.
rural
Leonel, por favor.
environments in
Bueno,
city.
Uruguay históricamente
Well,
ha tenido un sistema
historically,
sanitario
Uruguay
muy
has had
paternalista y
a very
que siempre vio
paternalistic
las
healthcare
actividades de
system,
autocuidado
which
como
also
algo
saw self-care as
sospechoso,
something
diría. Por lo
suspicious, let
tanto,
us say.
revertir
Uh,
esto es
and
una
reverting
tarea
that is
cultural
a
muy
cultural
importante.
task,
Quizás
and it's a
en
very
nuestra
important
experiencia
one.
histórica,
According to our
mayor hito
historical
respecto a
experience,
revertir esto se
the
dio
biggest
particularmente en un
milestone for
tema
reverting
muy
this was
polémico, muy
during
emblemático,
a
como es la
very
adopción del embarazo,
polemic
el aborto.
issue, which
En
is
el Uruguay el
abortion
aborto estaba
or interruption
prohibido
of pregnancy.
hace
In
20
Uruguay,
años
it
y era la
was
principal causa de
forbidden 20
de
years ago.
materna
It was the
y un
main
grupo
cause for
de
maternal
profesionales de la
mortality.
salud,
A group of healthcare professionals,
ginecólogos, parteras, médicos,
gynecologists,
establecimos una
midwives,
estrategia de
doctors
autocuidado sin
established a
saber que era una
self-care
estrategia de autocuidado.
strategy
La
without
estrategia
knowing it
estaba
was a
denominada de esta
self-care
manera,
strategy
que
because
se
that name did
denominó
not
Iniciativas
exist. It
Sanitarias
was called
contra el Aborto Provocado
Health
en Condiciones de
Initiatives
Riesgo, y que lo que
Against
hacía era,
Abortion
en el marco
Caused in
ilegal que
Risky
tenía el
Conditions.
aborto,
So,
generar
within that
condiciones
illegal character,
para que la
abortion
mujer
had we
estuviera
generated
informada,
conditions for women
supiera
to
los
be
riesgos,
informed,
supiera
to
cómo hacerse un
get to
aborto
know
con
what
menor
risks
riesgo
there were,
mediante el uso
to practice
de
an
elementos, en
abortion with
particular
lesser
del
risk
misoprostol,
by
los cuales no
using
se los dábamos porque no
drugs,
podíamos, pero
misoprostol.
sí les
We didn't give
podíamos
them
orientar
misoprostol because
cómo
we could do
eventualmente
that, but we
conseguirlos.
could
Todo eso estaba
guide
dentro
them
del
on
marco
how
de
to
lo que nos
get
permitía la
them. That
confidencialidad de
was
la
within the
relación
framework of
médico-paciente y
the
invocando siempre el buen
confidentiality
saber
in
de
the
la paciente y dejar ya tomar una
patient-doctor
decisión consciente
relationship,
que le
always
iba a
looking
implicar,
for
si
the
no hacíamos esto, una
superior
práctica
good
de mucho
of
riesgo e
these
inclusive un
women.
riesgo vital
Because if we didn't do
avalado por las
this, it could
evidencias
be a
empíricas.
vital risk.
Esta experiencia fue
And that
exitosísima,
was
no
evidence.
solamente en
This was a
términos
very successful experience, not only
epidemiológicos
in
del impacto que
epidemiological
tuvo
terms, because
en la
it had
disminución de
great
la
impact
morbilidad
in decreasing
evaluada por NIAR misma materna y de
morbidity
la mortalidad
um,
materna,
and
sino también por el
also
cambio cultural
maternal
que significó en
mortality, and
nuestro
also
país
the
el
cultural
hecho de
change it meant
visualizar el
in our
aborto
country
no
to
como
see
una
abortion
cuestión
not
de crimen,
as
sino como una
a
cuestión de
crime,
salud,
but
en el cual
as
la
a
figura
health
principal, la
issue.
protagonista era la
The
mujer
main
tomando
protagonists
decisiones
were
conscientes
women
y el equipo de
making
salud
decision,
apoyando esa
conscious
decisión.
decisions
Eso
and
modificó
healthcare
realmente
teams
históricamente lo
supporting
que fue la
those
visión
decisions. That
nacional
changed
de los
the
autocuidados
national
y hoy
view of
además sigue
self-care
vigente esta ley, porque la
all
ley
over the
encuentra
country,
en el
and this
Uruguay
law is still
permite la
there.
interrupción voluntaria del embarazo solo hasta las 12 semanas y a las
Our
14
law
semanas el
allows
embarazo de
abortion
liberación. Por
only
lo tanto,
to
esta ley,
12
que
weeks
su número
and to
es
14 weeks in
18426,
case of
se
rape.
aplica para los casos
This
en
law
que
is applied for
fuera de estos
cases
plazos
in which
seguimos,
it's
nuestros
outside
profesionales siguen
term.
informando para
Our
esta práctica de
professionals
autocuidados
continue
que creamos hace
informing
más
for
de
this
25 años.
self-care practice that we
La
created
práctica de
more than
autocuidados
25
y el
years
enfoque de
ago.
autocuidados también se aplican hoy en otros aspectos de salud sexual y
That's
reproductiva,
also
en
applied in
particular
other
lo que tiene que
aspects
ver
of
con
reproductive and
la
sexual health
prevención y el
care,
tratamiento del
particularly
HIV
for
y de la sífilis,
preventing and
o la
treating
política de
HIV,
drogas. Uruguay, como
via
saben, es
HIV and
pionero en la política de
syphilis.
despenalización del consumo de
As you
cannabis
know,
y
we were
estamos trabajando
pioneer
otros
in
en
medical
regulación de
cannabis
otros mercados,
consumption, and
en
we
la
are
industria de la
regulating
cocaína,
other markets,
principal
like the
causante del
cocaine
grave
market,
problema del
as the
narcotráfico
main
que hay hoy,
cause
y sin duda que
of
los
the
autocuidados tienen un rol
drug
fundamental. Y fuera del
trafficking
sistema
problem.
sanitario, los
Self-care is very
autocuidados,
important
hemos
there. And
desarrollado
outside the
experiencias
health
anteriores
system, we
de
have
gobierno de nuestra fuerza
developed in
política
former
con un modelo
governments
muy innovador
a
de
very
escuelas
innovative model,
promotoras de salud, en el cual las escuelas de educación primaria
health
de los
promoting
niños y
schools
niñas se
where
transformaron
primary
en verdaderos
um,
sistemas de
um,
promoción de los
primary
cuidados.
education children become
Gracias,
promote
Leonel.
of health.
Muchas gracias.
Thank you,
Bueno,
Leona. Thank you
en
very
estos
much.
minutos que nos quedan les voy a hacer
We
una
have
última
just a
pregunta,
few minutes, and I'll
que
ask
es la
you
siguiente.
the last
¿Cómo se
question. It's
han
the following.
utilizado las intervenciones de autocuidado para llegar a poblaciones
How have you used
desatendidas o de difícil acceso,
self-care
incluso
to
en
reach
entornos
people who are
humanitarios
difficult to access or who
o
get
frágiles?
few services,
Leonora.
including humanitarian
Bueno, Primero decir que
environment
esto que dijo
and
ahora
for
Leonel sobre la
people.
cultura
Well, first of all, what Lionel said about the
el sistema de salud
culture
paternalista se vive
of a
acá en Brasil
paternalistic
muchísimo
healthcare
también, o
system,
sea, es una
we
discusión muy
we
difícil
also
de
undergo that
hacer
in Brazil. It's a very
y la
difficult
gente
debate.
como que cree que tiene que esperar los profesionales todo,
The
entonces es una
people
discusión
think
súper importante.
they have to
Y
always go to
acá tenemos un
professionals.
programa que se
Very
llama
big debate. We
Programa
have a
Salud en la
program
Escuela,
called
que
Health
es
at
bastante
School
parecido con
program, which
que
is
también
quite
Leonel
similar
nos
to
contó
what
ahora,
Lionel
que
mentioned
son
today.
discusiones relacionadas a la salud que llevamos para
There
las
are
escuelas,
health-related conversations we
principalmente
take
los
to
adolescentes,
schools,
así,
particularly for
de
adolescents,
12 años para más,
12
así,
years on.
normalmente, ¿no? Se discute salud antes, pero este
We
programa
discuss about
especialmente
health
mira un poco
before,
más
but
para los
this
adolescentes y
also
discuten
is
cuestiones de prevención del
mainly for
embarazo en la
adolescents, and it
adolescencia,
discusses
la salud
um,
sexual y
preventing
reproductiva
pregnancy
en
during
general, ¿no? Para
adolescence and
impedir
um,
las las
sexual and
enfermedades
reproductive health,
sexualmente
generally speaking,
transmisibles, todo
and
eso.
also for
Es un
uh,
programa importantísimo acá y
transmissible
creemos que
diseases,
es un camino
communicable,
para
sorry, diseases. This is
el
very important,
futuro de
and I
Brasil
think this is the way
ya
to
venga con
go
las
in
personas
the
entendiendo
future of
cómo
Brazil.
es
We want
importante
people
el
to
autocuidado en
understand how
relación
important
a su vida
healthcare
sexual
is in
¿no?
connection
Y
to their
todo lo que dice
sexual
respecto a su salud
life and
eh,
everything in connection with
en
their
todas
uh,
etapas de la vida.
health at all life
La
stages.
participación social creo
Uh,
que responde
Social
un poco la
participation, I
pregunta,
think,
Gabriela, porque
and I
acá
here
tenemos
respond to
nuestra
your question,
legislación de
Gabriela, because
participación
our
social
legislation
bastante
deals with
ya
social
instituida, ¿no?
participation.
La,
And
los
we,
movimientos
our social
sociales en
participation is
Brasil
quite
hacen
well
un trabajo
instituted.
muy
Social
importante, traen
movements
las
in
discusiones de
Brazil do
estas
very important
poblaciones
work,
que tienen más
and
dificultad de acceso y
they
que son mucho más vulnerables.
bring um,
Y ellos
to
traen
debate
para las políticas
precisely the people who have
la necesidad
less
que tienen,
access
o sea, nos
concerning
ayudan de alguna
policies for the
manera a
need.
construir las políticas y
All
las
this helps us
acciones
to build
que
policies
lleguen
and
a
actions,
ellos, ¿no?
and we
Y no
want to reach
solo
them.
políticas generales que no van a ver estas especificidades. Entonces
It's not
creemos
only
que
general
esta
policies
participación
without
en
care for
nuestras
these
políticas en
specificities.
general es un camino
So
esencial
these
y acá en
policies
Brasil
are an
es
essential path.
bastante fuerte el trabajo que estas organizaciones hacen
The
con
work these
el
organizations
ministerio,
do in
con las
Brazil
secretarías
with
de
the
las provincias, de
ministry,
los municipios y
the
todo.
province
Entonces
and
es un
municipalities
camino
secretariats
importantísimo.
is very
Y
strong, and it's
además
a
de
very
eso tenemos
important path.
ahora
Besides,
que creo que tenemos que aprovechar, ¿no? La
and we
tecnología
have
y
to take
tenemos
into
un
advantage of
aplicativo
technology
bastante
now.
robusto de
We
salud
have
que
a
se
quite
llama
robust
MeoSUS
health
Digital,
app.
que es el
It's called
sistema de salud
Meus
digital.
Digital.
Y ahí adentro
Uh,
también tenemos un
and
montón de
in there,
informaciones.
we have a
Y
lot
no
of
solo esto, ahora
information.
vamos a tener informaciones interactivas para crianza, para los
And
niños,
we'll
los
have
adolescentes y
interactive
para las
information for
embarazadas.
children,
Y van a
adolescents, and
poder
pregnant women.
tener no solo informaciones, pero
And
también
they can have
poner
information,
sus datos, ¿no?
and they
Y
can also
utilizar
um,
este aplicativo
include
para el
their data
acompañamiento
using this app
de
to
sus embarazos y un
accompany
montón de
their
informaciones
pregnancies
ahí de
and
ayuda
getting lots
para que
of
la gente
information and
pueda
aid.
usar esto y ahí puede incluso tener una alerta, o sea, si
People can
tenés
use
esta
that, and
presión
it even
arterial,
has
eh,
alerts, for
seguro
example, for
busca
blood
un
pressure.
servicio, vaya
And
hasta
then
el
they tell you,
equipo
go
que
look
acompaña
for a
al
service,
prenatal,
go
o sea,
to
unas
the
cosas
team
así
that
bastante interactivas que estamos
is with
desarrollando y
you
creo que
in
de
your
diciembre de
prenatal
este año
care.
ya va a
We're
estar.
developing
Entonces
the
esto,
interactive app.
gracias
I
otra
un
vez,
they'll be
Bueno, muchas
ready in
un
gracias.
gusto.
December. Thank
Gracias.
you very much.
Mónica.
Pleasure. Mónica.
Bueno, como Como comentaba antes, yo creo que
As
la
I commented
apuesta
before, I
más
think
importante en
the
términos del
most
autocuidado y
important
del cuidado
bet
para el país en este momento,
concerning
en términos de esas
self-care and
poblaciones
care
desatendidas, de
in
difícil
our
acceso que
country
tenemos en brechas,
concerning
son los equipos
people who
básicos de
have
salud.
difficult access
Contar con 10.000
to health
más de
is
10.000 equipos en el
basic
país. En
health
este momento
systems. We have
abordan
more than
más de
10,000 teams in the
1.500.000
country.
hogares o
They
familias,
go to
3
more than
millones
1,500,000
600.000 personas,
households,
más de 25.000
more than
gestantes,
3
digamos,
million
con ese
people, more
acompañamiento
than
directo de los equipos
25,000
básicos es una
pregnant
apuesta
women.
fundamental. Los equipos
Thanks to
básicos
this,
se
it's a
priorizan en
fundamental
zonas
bet. They
y
are
en comunidades
prioritized
donde
for
la atención en
areas and
salud
communities,
de
well,
pronto no está tan
where health
disponible.
care
En
is not
muchos de los
so
municipios
available.
del país, pues
Many
solo hay una oferta muy
municipalities of
básica
the country,
y
there's
estos
very
equipos, pues
basic
por la modalidad que tienen, se
provision,
pueden
health
desplazar a
provision.
las
These teams
comunidades,
can
realizar
displace to
atenciones en las
communities
comunidades y ya
and
centrar
provide
todo este
care there.
ejercicio en estos planes de
We
cuidado que comentaba, creo que
focus
es
all
de lo
this
más ganador. Ahí
exercise
tenemos
in
unos retos, digamos, en
healthcare plans.
fortalecer la capacidad del equipo,
Our
disponer
challenge is to
esta suerte de
strengthen our team
herramientas que agradecemos de verdad
capacity
muchísimo
with
a la
great
OMS,
tools. Thank you very
disponernos a
much
los
to
países de ese tipo de
WHO
herramientas para
for
poder,
those
digamos,
tools.
incorporar eso en ese ejercicio y que le llegue hasta el
The
último
idea
rincón
is to
de este
incorporate
país
them in this
y
exercise
poder
to
incorporar
reach
en
the last
en este proceso perfiles comunitarios. Eso
uh,
es muy importante porque al
corner of
final
our
la
country,
adherencia de los procesos
incorporating community
en este tipo de
processes
intervenciones también
because
tiene que ver con esa
people have
confianza,
to
con saber
adhere
reconocer
to
quién es
these
ese otro que llega a mi
services. They have
casa, que
to
va a entrar a
trust
mi
them.
casa a hablar conmigo,
They'll
a robarme
come
la
in
atención
their
o
homes.
hacerme una consulta.
They
Y
will talk
finalmente
to me
ahí
in
ese
my
rol
home
del
and
perfil
will
comunitario, que
take
incluso
my
esos
blood
perfiles se
pressure. I have
ven
to
mucho en los
trust
territorios,
people.
perfiles propios de
So
salud, es decir,
we have
parteras,
to
médicos
be
tradicionales,
careful
sabedores
with
que se incorporan a
profiles,
este
health
ejercicio, pues
workers,
es muy, muy
midwives,
importante. Ahí en ese
traditional
marco hemos logrado ir haciendo
medicine
esa
men.
identificación de capacidades y
We
riesgos
have
y entonces
identified
logramos en este momento identificar
capacities
cuáles son
and
sus
risks, and
prácticas,
we have
prácticas de
identified
cuidado en
their
general, prácticas
care
propias, el
practices.
poder
They have their
definir
own
esos logros, como
care
mencionaba, y
practices,
poder hacer
and
seguimiento también
we
a la familia. Yo
need
creo que
to
ahí hay un
follow
abordaje
up
que es muy, muy
families.
importante y es esa primera red
That's very
que son
important.
las familias y
The
que el
first network
abordaje de
is
salud
the
familiar
family,
en este marco de la salud
and
familiar y comunitario
the,
es tan esencial, el
the
poder
family and
reconocer qué
community
tipo de
health
relaciones y
approach
dinámicas se dan en las familias y
requires
poder fortalecer
acknowledgement,
eso como una base
acknowledging the
muy
kind of
importante para el
relations in the
cuidado de sí,
family,
para el cuidado entre la
strengthening
misma
that
familia.
for
Creo que es la
um,
apuesta más clara que
inner
hoy tenemos.
care in
Lo
the
segundo es
family.
que tenemos una apuesta en ese marco de las redes,
Also,
tenemos una apuesta en términos de
concerning
redes de
network,
adolescentes y jóvenes y ahí se
adolescents
une,
and
digamos,
youth
con esos
networks
procesos de educación para
are
la salud que para
joined
adolescentes y
with
jóvenes tienen unos desarrollos específicos
healthcare
en
processes
términos de los derechos,
specifically
la
for them
garantía y el
in terms of
reconocimiento de los derechos
guaranteeing
sexuales y
their rights,
reproductivos.
their
Y ahí han
sexual and
habido unos desarrollos
reproductive
que también
rights.
el MinSalud va a
Uh,
distribuir y
the
va a
salud
poder, digamos, movilizar
is
en los
about to
territorios. Ahí hay un
distribute
ejercicio del
a
ministerio que yo
number
creo
of
que se fortalece
resources and
también
will
en este
deploy in
sentido
the
con la red
territory.
de educación en el campo de la salud. Es
The
una red donde
network
se
of
agrupan la
education
academia, donde
in
están
health
algunos actores
includes
relacionados
the
con
academia
este
and
proceso
other
y
players
tenemos ahí
connected
un
with this
ejercicio, digamos,
process.
juicioso que nos
And
permite
we
también tener
have
la voz
a
de la academia
critical
en toda esta
exercise
construcción.
there that
Hay
allows
unas
us to
apuestas,
have
digamos,
the
más en
uh,
términos de la atención en salud,
academia's
de
voice, and
autotoma
also
de ADN BPH que
healthcare,
se
like
está avanzando, que ya se han dispuesto las
self-sampling
regulaciones
for
y que, digamos, estamos
BPH
en ese proceso
uh,
de
or
implementación.
HPV, and
Procesos,
we're
digamos, con
implementing
comunidades
that.
étnicas,
We have processes
resaltar,
with
digamos, un
ethnic
proceso que estamos
communities
avanzando con
highlighting something we're
parteras y
doing with
parteros del
midwives
país que nos va a
um,
permitir, digamos, poder avanzar
and
en
male
en
midwives
los
in the country,
señalamientos que
or
hace la
mid
Corte,
husbands,
pero
I don't know
además
how
en un
they call
proceso
them,
de
and
articulación,
also
no solamente con los equipos básicos,
following
sino con una red muy amplia que
coordination
hay
with
de estos
basic
perfiles
teams and a
propios y
very
asimismo
broad
con las
network
comunidades indígenas
of
se está
profiles.
avanzando en ese
We also
marco
work with
de sistema
indigenous
propio
communities
intercultural indígena
with
y va a ser
an
muy, muy importante
intercultural
ahí el
system.
relevo que podamos
Uh,
darle a esas
it
prácticas de cuidado, pero además a
care
esas
practices
otras formas de ver la
there
salud
are
y
very
el cuidado.
important, and
Y por
we
último,
should
Gracias, Mónica.
take into account
solo
other
para señalar,
ways
lo último es
to
que creemos que
understand care.
las estrategias de
Finally,
información seguramente nos pudieran
information
permitir
strategies can
desplegar muchas
allow
de las
us to
herramientas que ustedes nos han
deploy
dispuesto allí,
many
no solamente para la
tools you
población en
have
general,
provided
sino
us
población
with,
con
not
brecha,
only
como puede
for
ser la población
general
migrante
population, but also
venezolana
people
que ha
with
sido
gaps,
acogida aquí en el
like
país. Gracias.
Venezuelan
Gracias, Mónica.
people that
Leonel, por
have been
favor.
Muy breve,
received by the
nosotros
country.
como
Lionel,
prioridad en
very
la gestión
briefly,
de
our
este
priority
periodo
in managing
tenemos
this period
el gran desafío de
is
disminuir los tiempos de espera
decreasing
en las consultas.
waiting
Hay
times
un
or lead
enorme tiempo
times
de espera
for
que estamos
um,
teniendo en las consultas y una de las
medical
estrategias que estamos
services.
pensando
One of the
justamente
strategies
para
we're
poder llevar
thinking
adelante
about
para
to
disminuir
carry
la
out
brecha que
to
existe
decrease
entre
the
la búsqueda
existing
de
gap
atención
between
sanitaria y el
seeking
logro de ese
health
primer
care
nivel de
and
atención
achieving
es
primary
uso
health
autocuidado
care
como
is
estrategia
self-care
para
as
implementar
a strategy
y
to
en
be
particular
implemented,
a través de la
particularly
telemedicina
through
que se
telemedicine
posiciona en la medicina
that
privada,
positions
medicina
itself in private
que tienen
medicine.
acá las personas ricas, se posiciona como una
These
alternativa
are
válida
the
que además es
rich
justamente mucho más
people's
necesaria en las personas que están en situación
medicine
socioeconómica más
provision, and we
desfavorecida
think we
y
should
sufriendo unas
use it
excepciones de
for
vulneración de derechos. Por
unfavored
eso
people
estamos
who have
pensando
their rights
en la
vulnerated.
estrategia de
That's
autocuidado
why we think
y
about
el
self-care
involucramiento de la misma para
as a
disminuir los tiempos de
strategy
espera. Y como
to
decía al
involve
principio
people
de la
and
primera
reduce
intervención,
lead
tratando que
time.
los
And as
autocuidados
I
tienen que
said at the
ser
beginning, we should try
concebidos
self-care
desde el
to
sistema de
be
salud,
conceived
asegurando la continuidad
inside
del
the health
servicio.
system,
De que esa
ensuring
intervención
a
de
health
autocuidado
care
inicial, si
continuity,
requiere otros
initial
niveles
health
de
care.
complejidad superior,
And then if
siempre
you
estén
require
vinculadas
higher
con los equipos de
complexity,
atención
you
primaria que
should
están
be
en la
related to
realidad,
primary
los
health
equipos de segundo
care
nivel a nivel del centro de
teams
salud
or
y con los
second
equipos
level teams
hospitalarios cuando así
and
lo
even
sea necesario.
hospitals when
Lo que creo
necessary.
que es muy
What I
importante
think is
en el
very
tema
important
cultural en nuestras
because of
sociedades
cultural
es
aspects in our
siempre hablar de que
societies
los
is to
autocuidados no
always
son
say that
cuidados de
self-care
segunda, sino
is
que son
not
cuidados
second class
de
care,
primera
it's
calidad
first
y de
class
primera
care,
seguridad
first quality,
para que
first
la
safety,
población
so
lo
that
tome y se empodere
the
como una
people
opción
take them
sanitaria adecuada
and
para la gestión de su
empowers
salud.
themselves in managing their
Muchas
health.
gracias, Leonel. Bueno, dado
Thank you
que
very
estamos
much,
un
Lionel.
poco
I
con
believe
poco
that
tiempo,
we
solo voy a
have
retomar
just
la
a little
base de
time
las
left,
respuestas y
and
las
I
explicaciones de
will,
ustedes han
well,
sido
your
muy claras.
presentations and
Entonces,
your
solo retomo
answers
esta
have been
idea de la
very
necesidad de
clear, so I
revertir
just
este
want
modelo
to
paternalista del
take up
sistema
this
sanitario y la importancia de
idea
contar, por un
of
lado, con un
the
marco legal que sostenga
paternalistic
políticas,
attitude
pero
towards
que esto
healthcare.
incluya la capacitación de
And so there
profesionales,
should be
especialmente del equipo básico,
not
atención primaria de
only
la salud,
the proposal
la
itself, but
información y la
also the
promoción de la
training
salud
for
para que las
healthcare
personas puedan
professionals
tomar
to
decisiones autónomas
to
y esas decisiones
empower
incluyen el
people
autocuidado.
to
El
make their own
autocuidado pensado,
decisions,
como
and also
resaltaba Leonel,
self-care,
como una
as
responsabilidad
Lionel
del
said,
Estado,
as a
como una herramienta
responsibility
más para
of the state,
facilitar el
as another
acceso de las
tool
personas al
to
cuidado de su salud,
facilitate
no
access
sin
of
el equipo de
people
salud.
to their
Solo sin
health,
el equipo de salud,
to
pero no es
the
necesario,
care
pero
for their
siempre con el
health,
apoyo del equipo de
with
salud.
the
La
support of
importancia
the
de las escuelas
team.
promotoras de salud, de
And
la educación
also
sexual integral,
the
del
courses, the
trabajo
schools
intersectorial y
of
tener en cuenta
self-care, the
la
intersectoral
maternidad,
work,
las
and
aplicaciones,
the
las redes sociales y
applications,
cómo
social
trabajar con
networks,
adolescentes y
and how to
niños.
work with
Muchísimas
teenagers.
gracias a
Thank you very
ustedes
much
y
to
seguimos
you all.
adelante con la
And
actividad.
so we will continue
Reitero las
with the
gracias, muchas
activity.
gracias,
Thank
doctora
you
Perrota,
very
y
much, Dr.
gracias a
Perrault.
cada uno y a cada una que
And
han contribuido.
thank you
Que creo
all.
que todo el mundo coincidirá,
I
una
believe that
oportunidad
everybody
estupenda,
agrees that it
un
was
lujo que hayan compartido con todos
a
nosotros
real
y
luxury to
estamos
have you
muy
with us.
agradecidos porque este
And
es un
we are
espacio que
very
se ha construido y va a seguir
grateful
funcionando.
because this
Quiero
space
decirles que
will continue
tenemos
to
más de
grow.
250 personas que se han
We have
conectado,
250
interesadas,
people that
y
have
hay
connected
mensajes
to
aquí
this
ocultos en el chat,
webinar,
saludos en su gran
and all
mayoría
kinds
de Perú,
of
Colombia, como
messages
ustedes,
in the chat
México, República Dominicana,
from
Guatemala,
Peru,
Trinidad y
from
Tobago, Costa
Mexico,
Rica,
from
Paraguay, Bolivia, Chile,
Paraguay,
Nicaragua, Honduras, Argentina,
Nicaragua, a
Brasil,
lot
Uruguay,
of
y así
countries.
sigue. Y cada
And
uno de los países con mucho
from each
interés
of these
en poder
countries with a
avanzar y
great
aprender.
interest
Para todos
to
y para
make
todas,
progress
que
and
repetimos,
to learn.
actualizar
So, at the end of this webinar, you will receive a link with all the information and also with a beautiful task you have to carry out. I want to introduce my colleague, our colleague Carl from WHO. Please look for the translation into Spanish. He will speak in Spanish, although he is learning Spanish. He will speak in English, although he is learning Spanish. And this will help us to continue building our workspace. We will all be able to contribute in the region of the Americas. Many of the questions are, how can I implement this in Peru? How can I implement it in Costa Rica? How do I create friendly spaces to talk with the teenagers? There are lots of questions that will be answered through the exercise that Carl is going to propose now, and the initiatives of self-care, who is heading the initiatives of self-care at global level and was awarded an award for innovation in 2023.
Rodolfo, but not thank you for introducing the fact that I'm asking people to work, to complete homework. But don't worry, it's very exciting. It's about your contribution to how we can strategize self-care at the regional level moving forward. So I'll be discussing today what can we do following this webinar, and more specifically, what we will cover in this session include the development of a regional roadmap, what it is, what it includes, how we will develop it, and how you can contribute. So this session was titled as an interactive session. So of course, please feel free to drop any questions you have in the Q&A box, but also we hope to continue this conversation through your input in this so-called homework that we will be sharing after this call. So we heard from our speaker that, and also question in the chat, that there is a pressing need to strengthen self-care strategies to respond to some of the key challenges we face in the region. That includes stagnating maternal mortality rates in the SDG era, but also inequities in access to care and structural challenges faced by the health system, such as increasing out-of-pocket expenditure and gap in the health and care workforce moving forward. We also saw that self-care is not new to the region, and actually presenters shared very advanced strategies empowering people with self-care. But we also see that many recommended interventions are not necessarily scaled up or fully integrated. We see that there are multiple barriers at the individual level. People are not necessarily aware of existing interventions, or they cannot access it because of the cost, because of the distance, or because the intervention is not culturally appropriate. At the policy level, we see barriers, including legal or regulatory barriers, but also logistical limitations. So a regional roadmap can really support better coordination among all stakeholders present here, including policymakers, but also program managers, researchers, the civil society, and donors. So what this roadmap would include. So this roadmap basically would help us to prioritize what are the evidence-based self-care interventions we want to see in the region, but also, and it was very well articulated in previous presentation, what is the enabling actions needed to facilitate the access to these interventions and leverage unlock their full potential. This roadmap will also better articulate how our investments and work can link to expected outputs, outcomes, and impact. And as it was mentioned in the chat, roadmap can also help to have a mechanism to track progresses in this area, but also share what are the good practices surrounding SRHR self-care. So this webinar really marked the end of the first phase of the roadmap development, which focused really on understanding where we are in the region, notably thanks to the policy mapping that PAHO released, but also all the experiences that were shared by the different countries during this webinar. And there was a lot of effort around sharing the available evidence, because as you've seen from Rodolfo's and Mangelo's presentation, there's a lot of work and evidence in this space that can be used. Now moving on to phase 2, we'll work on formulating this roadmap, and we'll do that by gathering your input through a regional survey and analyzing that input to identify what would be those priority interventions and enabling actions. PAHO will facilitate iterative discussions with a technical group of stakeholders that will include policymakers, CSOs, and scientists, and will leverage major public health events happening in the region, such as the ICFP conference. The goal is to finalize this roadmap early next year and release it with a toolbox to support you in advancing or unlocking the potential of self-care to advance UHC. So what is the homework? What is expected of you now? So following today's call, we'll share a link to this SRHR self-care survey, and your participation will support the identification of self-care interventions and enabling actions. The survey will be opened until the 27th of August. And of course, participation is entirely voluntary, but it's limited to individuals over 18 years old who attended today's webinar. And this is because the webinar provides the background and context you need to complete the survey meaningfully. You may choose to respond to that survey anonymously or not. If you choose not to be anonymous, you can also tell us whether you'd like to be contacted for future rounds of discussion related to the roadmap development. All data you share will be treated confidentially and stored in secure servers and analyzed only in aggregated forms. So again, this backdrop, I'll now proceed to present what is the homework with a step-by-step demo of the survey tool, which you can access through this QR code, and we'll be sharing the link as said after the call. So the survey is available in English, Spanish, and Portuguese. You can access it on your phone or computer, but I recommend to use a computer because it's much easier to respond. The language of the survey can be changed on the top of the screen. So what is this first section about? The first page, when you access the survey, mainly it includes information that I just presented. So what is the survey about and what is the process? But it also includes two interesting things. One is a link to the WHO webpage on self-care interventions. And the other is an email address that you can use to address your questions.
Sorry, you are not sharing the questionnaire.
Thank you. All right. All right, should be good now.
Yes. Now,
okay, perfect.
Thank you.
Right, so here is the important information is the language here. And the email to share your question here. So we ask you to answer your eligibility and consent question here. So of course, you're only able to access the survey if you are eligible and if you consent to it. And also we ask you if you'd like to be contacted for future rounds of discussion. Once you complete that section, you can continue the survey. So the second section includes social demographic information, which you may choose to fill if you choose not to remain anonymous. However, for all respondents, we ask you to indicate your country of residence. And this information is not identifiable to you, but it's crucial to understanding the responses from the rest of the survey. The bottom part of that first section asks two critical pieces of information. The first is, what is your role in relation to self-care intervention? And the second is, what is the SRHR domain that should be prioritized? I will spend a few minutes on those, and I encourage you to read the gray text here to have more information that complement this presentation. So, what is your role in relation to self-care interventions? Here we outline 4 roles that are derived from the WHO classifications of self-care interventions. You may choose one role that best reflects your responsibilities. Of course, you may have more than one role, but choose the one that best reflects your highest level of responsibility or your contribution. So what are these roles? The first one, and I think all of us are eligible for that role, is being a user of self-care interventions, meaning that you undertake an action or used interventions to maintain or promote your health and well-being. And other interventions are relatively straightforward. You can be a health care worker, you can be a health program manager, or you can be a policymaker. So now let's take a look at the second part of that question. What domain should be prioritized for self-care strategies? So there are 5 domains listed here, which are derived from the WHO Self-Care Intervention Guideline. And in the guideline, interventions are classified according to these categories. So of course, all domains are important, but we ask you to choose the one that best reflects your background, interest, or the one you clearly identify as a priority. So let's take a quick look. So the first domain is about healthy pregnancy. It includes interventions such as pregnancy self-testing, iron and folic acid supplementation. The second is about family planning, which includes self-administered injectable contraceptive, but also facilitated access to hormonal or emergency contraceptive. The third domain is related to prevention of unsafe abortion, mainly through self-management of medical abortion. The fourth relates to sexually transmitted infection using HPV self-sampling or HIV self-testing. And the fifth includes intervention related to sexual health more broadly, such as the use of lubricant during sexual intercourse. So I'll choose my role and my domain, and I can click next. So here we are. Now the homework begins. So depending on the selected domain, you'll see a table that lists all WHO recommended self-care intervention on the left side. And what you have to do is to rate them according to the impact and feasibility in your context. So when we say impact, it's not about assessing whether the intervention is beneficial to health or not, because it's already a WHO recommendation, meaning that it has gone through a rigorous process that establishes that this intervention is beneficial and scientifically sound. But what's really important is to understand in your context, reflect whether those interventions hold a transformative potential. And can it advance rights? Can it advance access to care, autonomy? Can it reduce inequities and lead to transformational change? Feasibility is with whether the intervention can realistically be implemented to achieve its impact. So do we have the staff we need? Are there supportive policies? Would the intervention be accessible to the community? There are no right or wrong answer. This is all about your perspective. So let's just do a quick example. The first recommendation is about self-administration of injectable contraceptive. Self-administration may have a transformational impact in enabling access to modern contraceptive for women facing strong barriers to accessing facility-based services. So we can believe that the impact is very high. But in my culture, the use of syringe is poorly perceived. So implementation may be, and uptake may be challenging and slow. So feasibility is too. And you can proceed with other recommendation. Once you complete it, you can click next. So now it's your turn in that question to tell us what self-care intervention related to your domain which is not in the list, has a high impact and high feasibility potential. Because the list only includes WHO recommendation, but there are other recommendations that may be really beneficial to your context and to the region. Stick to intervention related to devices, medication, technologies. Once you complete, you click next. Now that's the final part of the survey. And we ask you to assess again the impact and feasibility of WHO identified enabling interventions. And those are the interventions needed to unlock the potential of self-care, technologies, devices, medications. The interventions that are presented on the left column depend on your role, whether you're a self-care, whether you're a policymaker, you'll see a different set of interventions. Take your time to read through and reflect on the enabling power and feasibility. So when you think of impact, you can think of whether or not it will strengthen the health system capacity to support self-care, whether it's a sustainable change, whether it will improve equity. And again, when you rate feasibility, you can believe of how realistic it is to implement that specific intervention in your setting. Are there any barriers that may impede the implementation of that intervention? So just a little tip to guide you in answering that question. You can think of the previous section and you can think of a specific self-care intervention. So if we take, for example, self-administered contraceptives, we can think that, sorry, my Spanish is not great, but there's a question on procurements. I can't find it. But you can think that whether or not strengthening supply chain around self-administered injectable contraceptive would alleviate a systemic barrier. Perhaps in your country, you already have a very strong procurement system in place. So focusing on that might have a minimal impact, but maximal feasibility. Again, this is really about your perspective, your context, and take the time you need to answer these questions. The final question of the survey is about you again, and tell us about what interventions, what enabling interventions related to your domain, related to your role, can strengthen the self-care interventions. You can complete this question and either save the survey and accessing later on the same browser and using the same computer, or directly send the questionnaire. You can also decide to quit the survey at this stage. Your answers will not be saved, and you can also just go back to previous section to check your answers. Once you're done, you just complete that survey and it's done. All right, so I'm done, Rodolfo. I hope the homework is acceptable, accessible, understandable, and let me know if you have any question.
Thank you so much, Carl. It was crystal clear. Para todos, esto es una oportunidad de generar este espacio.
For all of you, this is a space to generate this cooperation space and very fruitful space so that we can start making, reaching this feasibility stage. The role it's a role, it's not a profession. For example, a midwife can be a legislator, can be a head of service, can be a local politician, or can work at a primary healthcare facility. So any doubts, you can ask you can ask me or Carl, or you can ask on the chat. And at the end of this event, you will receive the recording of this video and the presentations themselves, and the document related to this webinar. And now, as closure of our event, and closing this fantastic webinar, as a closure of this fantastic webinar, we will hear the words of our director, Suzanne Seruya, who is a gynecologist and obstetrics, works in obstetrics with a PhD in public health, and an expert in women's health and perinatal and reproductive health. And she has also worked in very important positions, such as at the Ministry of Health in Brazil and also at PAHO. And so, Suzanne, you can close our webinar, and I say goodbye to you and send you greetings. Thank you, Rodolfo. I want to start in a different way. I want to thank those who have participated here, because what we feel in this active chat, very active chat, with more than 130 observations and comments, and this is exactly what we want, because we want to discuss what self-care is. So I would like to start by with a conceptual issue, which is the autonomy of women, the greater role of the patient, of the person in our care, and the self-care this person should provide his or herself. This point of view has changed. Lionel, as the Health Minister of Uruguay, said, we also heard the presentation of Colombia about the rights of the patients, and Camila told us about social participation. What we're seeing in today's seminar is that we are including in this task all the network systems, all what we have done, all the structures, all the conceptual and factual data, and we are structuring the space that belongs to women, because we're talking about women here, about persons that are autonomous and can make their own decisions and take care of themselves. So what Carl said is very important. You are the most important people in order to continue with this dissemination, to participate, to increase this self-care network, and to make it become a strategy that will lead us to a better health of all people, and especially in this case of women. It's very important to look at what we heard today as something of the future. And when you participated here, we saw that there is a capacity of response in this audience. And when Carl's explanation of the survey finished, I was thinking about things that we might have forgotten, because we're talking about conception prevention, pregnancy prevention, and but there are other issues that might be in the heads of the 250 people that might be here. There are other interventions that we could call self-care interventions that are in other domains. Be creative, bring new ideas, because when we transform the strategy of self-care within the whole framework of health interventions and monitoring, etc., and this might change the health of all women and also of the rest of the population. I want to thank the 250 people that were with us today. I hope that you can continue participating, not only answering the roadmap, but also being able to divulge these ideas, because the health of women is our goal, and and you can put your interventions also on our YouTube. You will receive all the necessary links, etc. And I also want to thank the people in charge of the leadership for this meeting. You can imagine that behind this meeting there are more than 20 people, our colleagues from PAHO, that were here and took care of technical aspects and also the interventions of our invited speakers. We had excellent results. These have been two very interesting hours, and I believe that you can all push forward the greater autonomy and better health of women in your contexts. Thank you very much. In the name of the Department for Health Services, Health Systems and Services, and to the Department of Women's Health. Thank you very much.